What has shaken the health system in Nigeria and in other countries is clearly the COVID-19 pandemic. The countries who we all thought had very strong health systems were surprised that in many cases they could not cope. And those who had great fears for countries with very weak systems and expected the very worst didn't see that happen, which is again good for those who are in the low and middle income countries. But again, the knowledge and the lessons learned have strengthened the entire health system, particularly the public health security aspect, where there have been more laboratories than ever before in our history. We have more intensive care beds, more ventilators. In fact, it turned out we didn't use even a fraction of ventilators that we imported or procured, and more personal protective equipment, sanitizers. It also increased and stimulated manufacturing in pharmaceuticals, and that was a spin-off for Nigeria in that area.
If you want to call it collateral benefits, despite all the disadvantages and the disruption the pandemic has had caused to national life, what it's brought about is increased awareness and recognition of the need to invest in our national health security architecture, and it then resulted in recognition of the challenges that were existent and attracted the investments that were required to strengthen the system and, of course, respond to this pandemic. So we've had more investment in health emergency preparedness and response, both from a policy perspective in terms of strategy and costed plans. We've had more investments on ground in terms of strengthening surveillance, in terms of strengthening case management, which, for example, included the provision and construction of treatment and isolation centers across many of our hospitals in many states. We've had increased investment in risk communication, increased investment in specifically talking about surveillance. We've deployed digital surveillance tools to all local governments now, and there are ongoing efforts to ensure that we deploy to all health facilities and even down now looking at how to put in place community-based surveillance, because you need to be able to identify events or outbreaks for early response. But we also have invested substantially in diagnostics. So we've got a network of laboratories now. We continue to support these laboratories across many states and across the network. And also we've established in almost every state of the country a public health emergency operations center. These are very key because they provide a platform out of which all response to public health, any outbreak or any public health event can be done, and this will outlast COVID, specifically in terms of the benefits.
The emergence of the global coronavirus pandemic is one that has made countries to prioritize health security. Nigeria is not left behind in this, with the NCDC carrying out its mandate, which is to strengthen the nation's capacity to prevent, detect, and respond to disease outbreaks.
In terms of preparedness, yes, Nigeria, as you know, had what we call a joint external evaluation, which sort of looks at countries' ability to respond to public health events, whether in the human health, animal health, or even in the environment. We didn't do so well in the first edition, and then subsequent review showed that we had made progress. And now what we continue to do to fill in the gaps in terms of health emergency preparedness and response is to also increase our investments in the states and to help the states also put in place all that is needed for them to also respond to emergencies when they occur. So we are investing. We started in the last year and we continue to do so. We are doing state level joint external evaluations just to see where the gaps are and help the states to plug those gaps. The National Council for Health has actually approved proposals that are aimed to place states in a better position to manage emergencies when they occur.
With COVID-19 came variants, and Delta and Omicron were declared by the World Health Organization as variants of concern. Amidst the non-pharmaceutical interventions against the virus came respite, with the country recording a significant drop in infection rates. There, however, came an upsurge in the nation's COVID-19 cases somewhere along the line in the year under review. The country is currently battling with the fourth wave of COVID-19 and community spread of the Omicron variant.
Viruses mutate as they reproduce, as they are transmitted from one person to the other. As you allow for really uncontrolled transmission, they then have every opportunity to mutate. As long as that happens, we will continue to be at risk of the emergence of new variants. And new variants are emerging all of the time. What is different is that they do not always become labeled as variants of concern, or indeed before that variants of interest. For you to be labeled as a variant of concern, as you know, this variant needs to bring substantial changes to COVID epidemiology, either in terms of the number of cases it causes, increased transmissibility, reduced impact of vaccines and immune response, or increase in severity of the disease. And that's what we saw with Delta and with Omicron more recently. In terms of a previous variant combining with, or seeing mutations that combine changes that we are seeing in, say, maybe Delta or Omicron, again, that's not really surprising. As long as you have unmitigated transmission of all these variants and the virus is mutating, combinations or ongoing mutations that take into account everything, that combine everything that has previously happened, can occur. What will happen is that we then become worried if any of these mutations or combinations of mutations provide the virus such an advantage that it either again becomes more transmissible or causes more severe disease or causes more adverse outcomes, especially hospitalization and deaths. And we are not seeing that yet. We've already seen what Omicron did in Nigeria in terms of a rapid increase in the number of cases. In fact, for this wave, we've already had more cases reported than we had for Delta in the third wave. And if you're following the news, you can see what's going on in the US with Omicron. Hospitals are at a stretching point. Same thing is repeating itself, or is being observed throughout the UK and most of Europe as well. So that's what happens. But we continue to monitor for variants. At the moment, most of our cases are Omicron. Delta was already displaced as the predominant variant by week 46. And now we have literally almost 90+% majority of cases are Omicron. But I think the key message to take away is, as long as most of the population remains unvaccinated, as long as the virus continues to be transmitted without control in populations, new variants, every opportunity is available for new variants to emerge, which is why Nigerian citizens need to do their best to get vaccinated so that we continue to reduce the risk of that happening in our population. I think there are a lot of things that could be said, but I've got to focus on what's happening at the moment, which is still COVID. We have had we have had 3 waves. We are still in the 4th wave. We can see what's going on elsewhere. We are understandably tired of the pandemic, but it's important to highlight that the pandemic is not over. Okay, we should do the best that we can to make sure that we are not surprised by another variant. And what we can do is to make sure that we prevent or reduce transmission of this virus by ensuring that we are all vaccinated. If you've not been vaccinated before, please go out and get your vaccine. If you've been vaccinated, you've received 2 doses or 1 dose in the case of the Johnson & Johnson vaccine, please go and get your booster. That is my message to Nigerians as far as doing all that we can do to make sure that we do not continue to be terrorized by COVID. My desire really is that for anybody who has any symptoms, including those that they think it's like what they have when they have malaria, if you have a malaria test, please do a COVID test. So testing is available, and we continue to invest in increasing access to testing. So testing is available in all our public labs and available for free. At the moment, we are also rolling out, or we are ramping up the rollout of rapid diagnostic tests in health facilities across states, and that's an ongoing process. And this is meant, of course, to increase access to testing so that people do not necessarily have to wait for PCR tests that, yes, take a longer time, and can have rapid tests immediately within 15-20 minutes and know what is going on. So testing continues to be available outside of testing that is required for travel. For case management, for contact tracing, there's the opportunity to test in all public health laboratories across the country.
The country in the year under review reported 403 confirmed Lassa Fever cases in 15 states, with deaths reported. Cholera also reared its head in the year with casualties, as nearly all the states, including the FCT, reported cholera cases. Worst hit were the 6 northern states of Bauchi, Kano, Jigawa, Zamfara, Sokoto, and Katsina. In a bid to curb this outbreak in Bauchi State, which recorded the highest number of cases, benefited from the oral cholera vaccine administered in combination with other community control measures to stop the transmission of the disease.
Well, we talk about pillars of response, which usually include surveillance, case management, communication, diagnostics, emergency operations centers, and the like. And for COVID, as I highlighted earlier, as the template, the NCDC has continued to strengthen all these various pillars in terms of responding to COVID specifically during the 3rd and the 4th outbreak. Extending to other diseases, we also had Emergency Operations Center coordinating a multi-sectorial response at level 2 for cholera, because in 2021 we actually had literally the longest and most prolonged cholera outbreak that we have had in the country, where we had cholera in up to 33 states and the Federal Capital Territory. And we provided support to all of the states in responding to both cholera and COVID. We mobilized rapid response teams that were often operational in anything from 10 to 14 states at a time, especially helping states to coordinate and respond to cholera when that was going on. At the moment, we have emergency operations center going on for Lassa Fever as well, which, as you know, is typically increases this time of the year between November and May during the dry season. Lassa Fever has been a problem affecting a few countries in West Africa and not achieved global importance. And unfortunately, the countries that were predominantly affected also in the past had not previously invested in trying to find the vaccine, obviously because they've got competing health. You are dealing with cholera, you're dealing with meningitis, you're dealing with Lassa Fever. You've got competing priorities for investment. But in the last few years, there's been increased recognition of the need to to invest in that space. Nigeria had a national Lassa Fever conference where research priorities were spelled out, and as a matter of fact, the NCDC, along with partners including CEPI and others, are working on Lassa Fever with a view of better understanding the condition and identifying potential vaccine candidates for trials. Apart from developing our own local products, there are also ongoing efforts at the level of the ministry that I'm sure the Honorable Ministers of Health can speak better to actually establish vaccine manufacturing capacity in the country, so that at least you start off with being able to take, even if it's somebody else's product, but to manufacture it at
2021 was the year that efforts at the development of malaria vaccine recorded a huge success.
Nigeria has been part of the processes since 2010. Nigeria has attended all the meetings, all the decision-making meetings leading to the final adoption of the vaccines. And in the recent National Malaria Strategic Plan 2021 to 2025, the country has also included it as one of its interventions for the control of malaria, especially in children that are less than 5 years old. The malaria vaccine is to protect the children, especially those that are below the age of 5 years, who have not developed the partial immunity. Because when you live in an environment where there is malaria, over time you develop some level of immunity, which will not prevent you from having the infection, but will prevent you from having the severe form of the infection. In children, because they don't have this partial immunity, they are very vulnerable. They may develop the severe form, and that is why we still have hundreds of thousands of individuals still dying from malaria. Most of these are children. Like reported by WHO, about 67% of all the deaths due to malaria were in children that are less than 5 years. So with this vaccine, you give them some level of protection for a period, helping them until they get out of that year, that vulnerable years, which is the age of 5 years. It's not cast, it depends on where you are, and it depends on the level of exposure you have to mosquito bites. You may be older than 5, but you are not living where you have regular attacks. So you may be living in an endemic area, yet you don't have the partial immunity. So it is a function of getting exposed to the disease. Over time, you develop some partial immunity, which is exactly what this vaccine is trying to mimic. It gives you some partial immunity, which is not lifelong, like when you have measles vaccine and co. It is just for a while, and the vaccine, you will have to have it maybe repeatedly to be able to have some level of protection until you get out of the age of vulnerability.
The year ended on a good note for the health desk of the NTA, as the National Primary Healthcare Development Agency recognized the contributions of yours faithfully and another member of the desk, Oluseyi Adeagbo, for Nigeria's success at kicking the wild polio virus out of its shores, as well as the great support towards the country's response to the coronavirus pandemic, especially the ongoing COVID-19 vaccination and other primary healthcare services.
Thank you very much.
A standing ovation by the management and staff of the NPHCDA in appreciation of health journalists. The role of journalists as agents of change would always get a mention whenever Nigeria's polio eradication story is told. This role health journalists have also brought to bear on the various programs of the NPHCDA.
You're passionate about doing the right things. You're not trying to get news just for the sake of news. You're doing it because you know that by sharing correct information, we can work together towards getting to that road, that pathway of development that will ensure that Nigeria occupies its space in the Committee of Nations. So really, I thank you very much for your leadership.
The agency award, which was the maiden edition, was in categories comprising broadcast, print and online. Africa's largest TV network, the NTA, shone brightly at the event, clinching 2 of the awards, one for the Best Health Editor in the broadcast category, and the other, the Outstanding Correspondent Award, which went to yours faithfully.
The award means the agency itself recognizes the efforts of the media. And of course, the NTA had always been at the forefront, right from the period of polio. And of course, we're giving the best we can, even in the pandemic.
It came to me as a surprise, given that I had no prior knowledge of this. So I feel happy that I'm being recognized in this manner.
The National Primary Health Care Development Agency is the agency saddled with the mandate to control preventable diseases and improve access to basic health services, among other things.
That does it on our series of the review of the health sector in 2021. We look forward to a better and healthier 2022. Getting vaccinated against COVID-19 is a healthy and smart choice to make. A quick reminder also that you can go to our YouTube channel to watch the uploads of these and other episodes of the program. Email us for your comments and contributions at healthoptions@nta.gov.ng. I remain yours, Rabi Abdullah. Thanks for watching. Hope to see you again.